Hello everybody, my name is Dr. Jared Leon. Today I'm going to be giving you an exciting webinar on colic and its control on you enjoying your newborn. So why don't we get started, sit back, relax, take a pen and paper, and let's get started in case you want some notes. And let's begin. The beginning. You hopefully just had a miraculous birthing experience. You are loving being a new parent. Then you come home from the hospital and you realize the intensity of your little miracle. They are loud, always hungry, and positively cute. You are blessed to be surrounded by family and friends. The sad reality, your cute little blessing seems to be always cranky, crying, or fussy. Friends and your family may say your baby is acting colicky. Your little pride and joy seems bloated, gassy, and in pain. So what is colic? It refers to a condition in the infant during the first 3 months of life. This usually starts at about the age of 2 weeks if the infant is not premature, or a little later if he or she is premature. It is classically characterized as a crying attack that lasts more than 3 hours a day, more than 3 days a week, and more than 3 weeks at a time. It's called the rule of threes. Colic babies also have intestinal gas that causes severe pain in their abdominal area for the baby. Several signs of colic, once again defined as the rule of threes. If an otherwise healthy baby cries excessively, is unusually fussy, or displays signs of marked discomfort for 3 or more hours a day, 3 or more days a week, and for 3 or more weeks, he is said, or she, to have colic. What is colic? Fussing and crying are normal for infants, and a fussy baby doesn't necessarily have colic. In an otherwise healthy, well-fed baby, signs of colic include predictable crying episodes. A baby who has colic often cries about the same time every day, usually in the late afternoon or evening. Parents, of course, know best, so mothers can usually diagnose, as well as dads, by the way. Parents can usually diagnose their babies with colic. You do not need a medical diagnosis for this disorder. Causes of colic. Colic is tied to allergies to cow's milk protein in some children. In one Swedish study, when 18 moms of 19 breastfed infants who had colic gave up cow's milk and milk products, 13 babies completely recovered from colic. When the moms started drinking cow's milk again, the baby's colic returned. The infant's symptoms were gone between age 2 to 4 months. Colic can also be caused by an incorrect amount of the right probiotic in your baby's gut. Some research is finding that in one particular strain of probiotic is given called Lactobacillus reuteri, the baby's intestinal tract seems to calm down and the baby appears to have less pain. Colic and its effect on your family. Infant colic may seem like a condition that isn't serious, but researchers at Beth Israel Medical Center and Albert Einstein School of Medicine do not agree. They published results of their study back in July 2000 in Clinical Pediatric Journal that the emotions of the mother were affected by a colicky baby. 70% of the 23 mothers in the study had explicit aggressive thoughts and fantasies aimed at the baby, while 26% of them actually emitted thoughts of infanticide during the colic episodes, meaning ending the baby's life. Severe. All moms became emotional and had physical symptoms when their baby had colic. More than 90% of the moms also had marital stress and stress in personal relationships when they had colicky infant as well. So in other words, listen, when the baby's consistently crying, you already know, you're probably listening to this. We both know that we're on edge, and it's much harder, beyond just the newborn alone, to get along with family and friends, especially spouses. Colic and its effect on your whole family. Parents of infant colic are also reported to have significantly higher stress levels than parents that do not have to deal with colic. The frustration and the stress of trying to soothe a colicky baby may interfere with the mother bonding. The mother-baby bonding can also increase the risk of postpartum depression. In addition, colicky babies are more likely to be victims of shaken baby syndrome and child abuse. I don't mean to be grim here. I'm just giving you the facts in the very beginning so I give you the silver lining and all the happy stuff coming up. Common current medical conditions and treatments. Gas relief medication. Available over-the-counter gas relief medication such as simethicone, which is really St. Joseph's Baby Infant Gas Relief, Infant Milacon Gas Relief, and others. Acid reflux medications available with the prescription such as Nexium oral, Acifex oral, Prilosec oral, and Prevacid oral. Common side effects of medications. This is an important one. A lot of times we're going at desperate needs right now, but we don't think of the potential side effects. The more common ones are going to be diarrhea, skin rash or itching. Less common, abdominal or stomach pain, increased or decreased appetite, joint pains, and nausea. Let's look at some common current holistic treatments. Probiotics we've already discussed, but probiotics specifically, Lactobacillus reuteri, has really been shown to reduce the symptoms of colic. Let's look at certain recommendations. We're looking at tummy time. Simply lay your baby on its tummy across your stomach, your lap, or in a boppy pillow. Of course, it's a newborn. Please be careful not to leave the baby unattended and only do it while standing there for small bits of time. Carrying your baby. Hold the baby close, consistently comforting the baby. I know we don't want to get the baby attached too much to being held consistently, but current model shows carrying the baby can really help a lot. Repetitive motions such as rocking the baby, going for a drive, an infant swing might really help a lot. You can hold your child upright after feedings. This will help a lot of times in case they're also having gastroesophageal reflux disease, which I don't like to call a disease, but medicine is diagnosed as GERD. It may be a contributing factor for colic. We can also try using different formulas. Now, of course, I hope that you're breastfeeding. And if you are breastfeeding, just watch your diet and continue breastfeeding. But if not, we can try switching formulas. You can do a dairy-free formula. You can try organic formulas. Let's see if that makes a change. Other common potential helpful ideas and techniques to help. Try feeding her or him half as much and twice as often. So simply, it would be easier for the baby to digest smaller amounts, and it might leave less time for spitting up, which might also decrease the amount of potential abdominal distress. You could try regular burping throughout each feeding may also help. And again, if you are breastfeeding, keep it up as long as you can. Other potential helpful ideas, babies who are colic, you can swaddle the babies. Sometimes swaddling or keeping them tighter makes them just feel less pressure on their belly or increases the pressure, which reduces the symptom. Just a little potential happy thought. We can also make it simple and happy by passing the baby around to all the family and friends that come to you, right? We can try that as well. Sometimes you also might need a break, and this is important. If you need a break, take a moment, let the baby cry it out for a second, and walk away, reset yourself, and come back. They can pick up on your emotions. More common potential helpful comforting remedies. We just spoke about taking a break. You can simply also have fun and laugh with your baby. Try smiling, because sometimes smiling might make a huge difference. How does chiropractic help children who are suffering from colic? So this is a little bit more than just a potential idea. This might be the new avenue to think of. Infants, like adults, can have spinal misalignments. For an example, a child that has gone through a difficult birthing process and experienced trauma could have a true need for chiropractic care. It's possible that the skull bones of the infant could have been compressed, the neck twisted in such a way to create a misalignment, and the rest of the spine will be affected. What does chiropractic do? We're going to get really into this in a few minutes, but what can it do? One of the things that a chiropractor does, it delivers a gentle force, and that gentle force into the spine will put that spinal bone back into place, thereby optimizing and taking away the interference of how the nerves travel, and in specific, from colic, as the brain sends signals through the spinal cord out through the spinal nerve, that they speak and talk to that stomach. The interference is gone, and the stomach and small intestine, large intestine, and rectum become more efficient. Let's look at specific cases of infants with colic that we've seen in the office. The first infant was 7 weeks old and was diagnosed with colic from a primary healthcare physician, as well as acid reflux and problems sleeping. These three issues were constant since he was born. The little boy had experienced birth trauma, and at this tender age, a dysfunction of his upper neck or cervical spine and sacral joint were found and recorded. The boy received chiropractic adjustments over a 3-week period, and all of his symptoms resolved completely. Let's look at another case study. The second infant was 10 weeks old. Her mother diagnosed her of colic, which had been a problem for the previous 6 weeks. This little girl had vomiting and preferred breastfeeding on one breast only versus the other. She also experienced birth trauma, and at this tender age, she had similar dysfunctions of the skull and spine as the little 7-week-old boy I just talked of. The girl received chiropractic adjustments over a 3-week period, and all of her symptoms resolved as well. The third case study that I'd like to quickly share, I recently took care of a super cute newborn boy. This guy was awesome. Just 3 weeks old, that was diagnosed with colic and acid reflux by his pediatrician. I evaluated his spine and nervous system and found an upper cervical subluxation called an atlas subluxation, a first rib subluxation, and a sacral subluxation. After his first adjustment with the use of an activator gentle adjusting instrument, the baby slept for the first time for 4 hours. After his third adjustment, the child started holding his adjustments, meaning they didn't keep coming out each time I saw them on the third adjustments. The parents stated that it was a miracle. He slept when put down and, most importantly, was not in gastric pain. They also stated that his global affect or mood has improved. What was it about the chiropractic adjustments that created such happy babies when these babies were so miserable to start with? It's possible that the birth trauma caused the development of these dysfunctions in the skull and in different parts of the spine, and thus the symptoms of colic were created. Because chiropractic restores the spinal motion and the cranial motion, the symptoms completely resolved. These symptoms were a clue as to what was wrong with these babies, and when the clue was followed up with the treatment, the chiropractic adjustment took care of the situation so the child can heal on its own. What is the common link between all three cases? These three cases teach us that when there's birth trauma, the autonomic nerve system can easily become imbalanced and cause certain reflexes to occur in the body. Crying, vomiting, and acid reflux and sleep disturbances are all examples of this. The babies didn't want to not sleep or consistently cry or vomit for hours. It was a natural reflex that was happening in their bodies because of the birth trauma. And let me just go take a moment as an aside. A birth trauma does not have to be this crucial moment of life that you think the baby's in need or in distress. It could simply be from the delivery. Were forceps involved? Was a vacuum extraction? Did you have a baby with a C-section? Were there any kind of complications? Was the baby crowning for a long period of time, therefore causing a distress on the baby's skull? Did the doctor accidentally turn the baby's neck too far on one side or the other? These can also be classified as birth trauma. Research. Let's look at some research now. Research studies give more insight into colicky babies. The chiropractic or chiropractors adjusted infants with colic who were a little over a month old. The babies had 3 adjustments within 2 weeks. The babies' moms kept a diary of these babies' progress, and at the end of the study, the chiropractic did an assessment of the results. The adjustments brought satisfactory results, and the moms were happy in 94% of the 316 babies in the study. Less tears with chiropractic adjustments and more research. In Denmark, researchers ran an official randomized controls trial, one of these types of trials that gets the mark of excellence from the scientific field, to see whether or not there would be an effect on infants for colic if they were given chiropractic adjustments. They divided the infants into 2 groups, one that received adjustments and one for 2 weeks, and one group that just received a drug called dimethicone for the same amount of time. So 2 weeks of drugs, 2 weeks of just babies getting adjusted. The nurses kept records of how long the babies were crying each day for the same type of study. There was a huge difference found. By days 4 to 7, the infants given the drug cried 60 minutes less, while the infants receiving chiropractic adjustments cried 144 minutes less. On days 8 through 11, the infants given the drug cried 60 minutes less, while the infants receiving chiropractic cried 162 minutes less. The researchers concluded that chiropractic is a better solution for infants with colic and drugs. Let's look at some long-term studies of adjustments and colicky. The next question I always hear is, so what happened a month later? So 4 weeks after that study I just described, 82% of the babies in the chiropractic adjustment group still resolved from their colic. Pretty cool. How can chiropractic help with colic? That is the other question we hear every day. So any vertebral subluxation, which simply means a bone out of place causing an indirect pressure on the spinal nerve, causes disturbance to the nerves in the stomach, intestine, and other abdominal organs that could adversely affect gastric function. And the result is discomfort, gas, and other colic symptoms. The chiropractor specializes in the detection and correction of subluxations. As chiropractic helps to restore normal function in the child's nerve system, the infant's digestive tract and other related organs have a better opportunity to receive nerve supply from the brain, bringing it back to the full normal innate potential. The result is a happy and content baby. A very effective treatment for colic babies is visiting a pediatric chiropractor. A pediatric chiropractor can help your colic baby and soothe their pain after a few visits. There has been promising results on chiropractic care on colicky baby. A newborn can experience a spinal misalignment during birth, which can make them more susceptible to colic. This can be, very common and can occur and happen to babies when they are born breech through C-section, forceps, vacuum, or during birthing itself. Being born with a spinal misalignment can cause a problem to the nervous system as well as the digestive or enteric system. A chiropractor can gently adjust the child, which will then restore the normal functions in their nervous and digestive systems and eliminate colic altogether. Chiropractic care is a conservative, gentle, and very successful option for treating infants with colic. Chiropractic adjustments for infants are specific, gentle, and extremely safe. The International Chiropractic Pediatric Association has a huge database of chiropractors who specialize and work on pregnancy, babies, and children. You can go look up that site for under www.icpa4kids.org/locator. In conclusion, if your infant has colic, or acid reflux or stomach problems or is crying consistently for the rule of threes, if you're just not having an amazing time being a parent, if there's a chance that you think you've tried medicine or you don't want to try medicine, come try to get a checkup. Go to an ICPA or a pediatric chiropractor and get a spinal checkup. It cannot hurt the baby. The chiropractor will tell you honestly and ethically if they can help and if they can't. Some chiropractors will not work on children. You can call up and ask. Do not go to those kind of chiropractors. But the ones that do usually will open their arms and offer a loving, healing environment that you and your baby will feel very comfortable. Call the office today to schedule an appointment or to set up a free consultation. My telephone number is 631-689-1000. I look forward to hearing from you. I wish you well, but realize that I've helped hundreds of babies with colic. You do not have, let's just talk about the fun stuff, but not really, man. I have 2 children. I know how hard it is. A newborn alone is extremely hard. A newborn that is consistently crying is that much harder. There's a way. There's a chance. Let's increase the probability. Let's hope for the best. I look forward to start your healing process with you. I encourage you to call, once again, 631-689-1000. Set up an appointment. Let me give you a free consult. Let's meet face to face. Let's talk this out. You are not alone. I wish you well. Thank you for your time. Have a great day.